This podcast is for general information purposes only and is not intended to create a physician-patient relationship. It is also not intended as a substitute for diagnosis, treatment, and/or advice by a qualified healthcare provider. Please promptly schedule an appointment with a qualified healthcare provider if you have a healthcare condition that has not been diagnosed or that is not under the regular care of a healthcare provider, or you're considering changes to your diet or exercise routines. Please refrain from self-diagnosis and/or self-treatment. And if you have a medical condition situation that may be urgent, then you should immediately report to the nearest emergency room.
And flat tires called jobs. But if you have a spear called determination and an engine called perseverance, with insurance called faith and the drive to make it, you'll reach a place called success.
All right, this is Dr.J. Welcome you to Reach a Place Called Success. I'm so happy to, on this rainy day, have my friend Dr. Marco Alcala calling in from Pittsburgh. Again, we're on Zoom meeting because of the COVID issues. We had this scheduled weeks ago, but Dr. Marco Alcala is a close friend. He is a family medicine residency physician, did a couple years training in surgical residency and ended up doing a fellowship in sports medicine. He's team physician for the Pittsburg Pirates, and he has a specialty in concussions and post-concussive syndrome. So we're going to be talking about a lot of different things today. Welcome, Marco.
Thank you so much for having me, Jay.
Absolutely. Yeah, we had this rescheduled from a couple of weeks ago. And interestingly enough, the gentleman that I was supposed to be on that trip with did come down with COVID-19. So you and I are both glad that we never had that trip, because I think you and I and probably our families would have ended up having it.
Oh, yeah. Yeah, we would have been away from our families for a good 2 weeks, and seeing people that I know going through that right now and quarantining themselves in a room to the house too has been pretty painful for everybody. So I'm glad you're fine.
Absolutely. Yeah. I had to drive my next door neighbor. Actually, you see his house right there. He had diagnosed just this last week with double pneumonia and COVID-19, had shortness of breath, had a bunch of issues. So I took him into the hospital. And thank goodness it was just a lot of different supplements that he was taking, just crazy amounts of
Wow.
different things to try and make himself healthy. But so he's back at home, convalescing and feeling a lot better. So
Good for him. No, this is it's scaring everybody. I mean, my family members, we have a positive family member in New Jersey as well. So, and my family and have all been exposed. So they've all been self-quarantining for now. So far, so good. They're coming out of it.
thank goodness. All right. So let's talk a little bit about, you've been practicing now how many years in Pittsburgh?
About 14 years now. In
And
Pittsburgh.
walk me through how you got into that job and kind of what you do.
If I start off real quick, being in New Jersey, doing a surgical residency for 2 years, and then coming to Pittsburgh to do research at Pitt and University of Pittsburgh, did 3 years of National Institute of Health research in surgical oncology, thinking that I was going to go back into surgery, and publishing several articles and journal covers and things of that nature, and realizing that I had my daughter at that point, and 3 years of research versus 2 years of surgical residency was like a vacation. And it's like what I would say being in prison for 2 years, and then you're allowed to come out for 3 years, but you have to come back and do 3 more years of your sentence, and decided not to go back. I realized the lifestyle is not conducive to what I want, which is being a family man. And that's what I am at heart, is a family person. So I wanted a career that would give me that opportunity. And not that family medicine is a cliche, but family medicine was definitely more of an outpatient environment. And that's what I was looking for. And that gave me the opportunity to have a second child. And then knowing my background in surgery, I didn't want to just sit there and do diabetes and COPD and the repetitive stuff and just tell people to stop smoking, because, it's hard. to get people to change. I wanted more hands-on, and that led to realizing there was a sports medicine fellowship that does all that: anatomy, orthopedics, team physician, things that I can get my family more involved in. And that led to doing rotations with the Pirates, Allegheny Health Network, sports medicine department, and hanging out in town and liking Pittsburgh and staying in Pittsburgh, and then applying for a fellowship in sports medicine, and they took me right in. It was a perfect match. We enjoyed it. They enjoyed us. And now I have 3 kids and a good career in sports medicine. I'm a team physician for Avonworth High School as well, but I'm also the district physician for the school district of Avonworth in Pennsylvania, in addition to being a team physician for the Pirates. I mean, it can't get any better than that. Going to spring training with them, although that's been on hold with all this, so I got postponed.
Sure.
For the new spring training when it starts up again. So, we'll see where that goes. But, I covered rugby. I covered so many sports that you could bring your kids to the sidelines and have a good time with them. And what opportunity to have for a child to see all that at firsthand. Nowadays, they look at it like it's no big deal, and they take it for granted. I'm like, you guys have no idea what you're looking at. You're watching a football game right in front of you. You're looking at Pirates game right in front of you. You're looking at all this stuff in front of you, meeting players, and they're just like taking pictures of these players and have no clue who they are, so it's interesting. I grew up inner city and grew up in Jersey City with the Giants and the Jets, and never, ever being close to them in any way.
It's true. Absolutely. So how often do you see the athletes, both professionally and from the high school level, versus just routine patients that are they mixed out throughout the day? Like, how do you run a training room? What do you do?
So our training room is, for me, kind of virtual. I mean, we have a trainer at our school levels. All our doctors have trainers that are a liaison for us at the school level. And if there's an injury or there's something that needs to be seen right away, we have an open door policy for them. They send them right in and we get them in the door right away. Or if people without insurance or kids that are Spanish, because I'm a Spanish speaking, I'm Spanish myself, I would sometimes go to the school level. And so they don't have to pay for insurance or pay for their care, and just kind of see the kids, talk to the parents at the school level. And so sometimes we go to the school and see some of these athletes. We cover the high school games, I cover the football games, and just recently they made it all the way through, Whitfield finals and the championships, and we went to Hershey. So we are back and forth with them, and we constantly talk to the trainers to give us updates as to what's going on, and we facilitate their access to us. The Pirates, if there's a special case where one of us needs to see one of the Pirates, sometimes they either see us in the office, like VIP access, or we go to the stadium and take a look at somebody. But when the season's on, we tend to all take turns covering the games. So there's an orthopedic surgeon and there's one of us primary care sports medicine doctors at each game. And we cover maybe 2 or 3 games a month. As they happen in real time when we're there, we cover the games in person. When we're not, and there's another meet or an event, and if someone gets hurt, then the trainer just calls us and we get them in the door pretty quickly. So that's one thing that we have. We have about 20 something schools in our region, and we're all accessible to all of them. Some of these high schools are like small colleges too. So it could be a handful, but it keeps us busy in the school season, especially during the football season. Which leads to, coverage for pretty much any event. We also cover marathons. Sometimes I cover wrestling and boxing matches, or have fellows go out for the boxing matches, since my thing is going to be more on the boxing side. I took that on as my baby. And so I get called from a lot of the trainers from these boxing events to call us to have coverage for that, so we can be ringside physicians as well.
Is that because you have a personal interest in that?
That led to, I'm more of a martial artist, but that led to recently picking up boxing to train, but not to compete. So I basically just get the training under that and do some combat training, stick fighting, self-defense, things of that nature. But that led to being a ringside physician back in the day during my residency, and then making all those contacts and being a cut man for a friend who asked me to be his corner man, which I never had that as an experience. But for him to ask me, hey, since you've been doing my physicals, can you do my physicals for me? Sure, no big deal. I become his physician, no big deal. Hey, can you be my corner man? I'm like, what are you talking about? What do you mean? I'm like, well, can you be my cut man? I'm like, I've done surgery, but I've never had to do cut man. Where he's like, well, I just turned pro and everything like that, and it just gave me an opportunity. Like, yeah, why not? How often do you get someone ask you to be a cut man for the corner? And that opened me up to another world of, I like to never really say no to opportunities, and when you don't, you'd be surprised what world opens up for you and what doors open for you. So through that, he was 11-1 record. And so can you imagine 12 matches of being in a corner man, cut man, and never having to actually cut him open, which is nice. His name was Josh, the handsome hitman Himes. He's a Monaca, Pennsylvania resident, married a country singer. They just had 2 kids just now. And so he's kind of stopped and retired and decided to pursue his degree and move forward. So one of the smart ones,
That's great. Classic story.
It's an interesting world. Yeah, exactly. Time to stop. He's only about 20 something years old, but it's time to stop. And he never really got hurt, which was nice. Maybe 1 concussion. But learning through that, meeting the athletic commissioner of Pennsylvania, and he's the one that actually trains me in boxing. We both have a need to help people with concussions, and how there's no concussion protocols out there for boxers, except that they tell you that you're not allowed to fight for 3 months after a knockout. But who determines that 3-month period? These people are still injured after 3 months, and it takes 6 months, sometimes, or a year, and they're still having cognitive issues, and they're still fighting. There's no reason why you can't train, but these people just go back in and get hit. And that's why their lifespans are so short when it comes to boxing, and they become trainers, almost like, I can't function well, so let me just be a trainer for other boxers. And they could barely speak right. They could barely write. And all that can change if they just have baseline concussion testing, things like that, something tangible that they can use to help themselves get back into the sport when they were ready. And that's what we've been doing, trying to do pilot programs for them, for these trainers, for these gyms locally. And a lot of people send their trainers and boxers to us when they get hurt. So some people are willing to take the baseline concussion testing, some people have not. So it's been interesting to see the ripple effect of that.
So when did that actually come to fruition? Because I've seen it now, the baseline concussion protocol, the testing that's been done. When did that become something that is pretty common at this point?
Well, I did my fellowship 2013, and they were doing it then, but it wasn't so impactful. And the one thing that people do or use back then was the impact test, which is what everybody knows about. And the University of Pittsburgh is what they were involved in that one. There's another one now, C3 Logics testing, and that's kind of comprehensive as an iPad-based test. They're checking for cognitive function. And so I would say 2013, they were doing it. Maybe another 3 or 4 years before that, they started doing it. 2009 or so.
Interesting. So
that's all to.
Go ahead.
No, go ahead.
So it's interesting though, because like one of the most important things I think is first identifying that there's a potential injury. The athlete a lot of the times he's got endorphins running, doesn't want to admit that there's potentially something going on. He or she wants to get back onto that field. So really the first thing that needs to be done, I would assume, is that either the trainer or the physician or the coach or the players that are working with the other athlete have to be in tune to what is happening on that field to really identify there could be a potential problem here. It needs to be examined further.
You're right. And that, to me, concussion is all about education. Educating everybody involved, from the trainers, from the boxing trainers. You would think that those trainers would be up to date with the latest concussion information to be able to guide their fighters, but they're all prize fighters and they're all making money for the trainers. And if you stop them from fighting, then, so it's more of a business. On the high school level, the trainers that we have out there are up to par and up to date with all of this stuff, so they know what to look for, what signs. And if you do have the adrenaline flowing when you get injured, we still get you out. So we say, when in doubt, sit them out. If you're still worrying about it, it's against the law not to get these athletes back again. And the danger would be that second impact syndrome, where you miss a concussion and they go back in, they get hurt on the field and they collapse and die. Now, there's like less than 1% chance of that happening, but it does happen. But that's what you worry about the most. We've been teaching, I do a lot of promotional lectures in my community. I'm the North Hills concussion guy because we don't have anybody up here. I try to sponsor a baseball team locally for the youth baseball and things like that. And sometimes they ask us to go give talks and just kind of educate the general public about what the major signs are, what to look for. If you feel headachy or pressure in the head, or you feel dizzy, nauseated, that you should sit out. These kids feel like it's the last touchdown. I just need to score one more point and we're done. It's always the last one. It's always the championship game. It's always that one thing that they don't want to sit out for. But if the parents are aware about that too, and the kids are even keeled, you can penetrate a lot more people than not. So these conferences and lectures and educating these auditoriums full of kids and parents have been helpful, where people are talking about it more and more. It's coming to fruition. Like that ripple effect of education has been helpful. But these club sports, they don't honor any of these things. They do whatever they want, and yes, you can get lucky, you can get better, but there are people who've been out for years. We don't see everybody with a concussion. Most people get better, but the ones that we do see are having issues for a year or two out. And we've been able to help them better with the new protocols that we've been doing. So it's just another tool in our tool belt that we have to help people get better. But if they don't want help, they're going to move forward. There's a lot of people out there who are not just right, quote unquote. I just don't feel right. But I remember having a concussion 10 years ago. I'm just not right. But what are you going to do? Move on with yourself. So they move forward. They think that that's their new normal for them.
Sure. Well, I want to get to that in a second, but you've hit on a lot of points that I just want to drive home a little bit more, maybe dive into. So the education,
Sure.
I think you hit it, is absolutely the most critical thing. As a parent or a friend, family member that's watching an athlete, what are the things that they can be looking for? Is it just if they're not behaving properly? Are they just, you're always watching, obviously, your family member or whoever that you're coming in to cheer for. But what are the things that somebody as a spectator would be able to, hey, listen, there should be something that cues them to kind of, give notice that there might be something wrong?
Well, immediately after any injury, any concussion injury, the red flag symptoms, meaning red flag symptoms that somebody needs to run to the hospital pretty quickly after an injury. We call them red flag symptoms, almost like if you could imagine somebody with a stroke. One pupil is larger than the other. They're falling, they're walking not straight, they're just walking at an angle, they're just falling over. They're vomiting excessively. You witness them have a seizure on the field, or they had loss of consciousness for more than, even 30 seconds or less. Slurring their speech, those kind of things are like straight to the ER. But if you're unsure and nothing like that happened, and they're walking around kind of confused or repeating themselves or not acknowledging that they just scored a point, a little bit of a headache, or the lights from the Friday night lights are bothering them too much, which it wasn't a few minutes ago. So you were just fine, but now after that, everything kind of bothers you. You're sensitive. It's like your brain went haywire, and you become sensitive to almost everything. Loud noises, lights. You can't carry a normal conversation because you're not making sense, or people are not making sense to you. Again, the dizziness, moving your eyes side to side, just looking around, just gives you some eye strain where you're blinking a lot. Head motion, just moving side to side. You feel like, oh my God, I feel dizzy just moving my head around, but I didn't do anything. So people don't think that they're doing anything, and that's the misconception. I wasn't doing anything. I was at home doing nothing.
Yeah.
But when I tell people that having a concussion and being at home is like an adventure on its own. If I do laundry and I'm moving side to side, I get dizzy.
Sure.
If I'm looking at a hockey game on TV and my eyes are going side to side. And I'm like, oh my God, I can't even look at this, but I keep pushing forward and looking because eye strain is not bad enough to stop people from doing their thing. So they keep pushing through, and then they develop those headaches, and then they feel wiped out, tired, exhausted, and they're always sleeping and taking naps. Those are signs of somebody with a concussion. And if they haven't improved within 3 or 4 days or so, then it's time for them to go see someone to tell you how to get them better faster.
Now, the danger you had mentioned is putting someone back into that role too early and having a second impact syndrome. Explain actually a little bit of detail. People do like to understand, well, what does that actually mean? And why is death potentially an issue when you're talking about this? People talk about getting your bell rung. That's what we would call it, obviously, growing up. So explain kind of what that second impact syndrome actually means.
So imagine your brain getting injured, you crash into something, there's a deceleration of your brain, a sudden deceleration where you don't even have to hit your head. You could be ice skating and you land on your bum, sudden jerking motion where the energy transmits to your head and causes a violent shaking. Your brain bounces around in the skull. And when it bounces back and forth or side to side or twisting, it hits a certain part of the brain. And imagine your brain causing a swelling. You're having swelling in your brain. Now you have this issue where you need to let the brain come down again. And as you're letting it heal, in the process of that, you get hit again. And it causes another, imagine swelling again on top of swelling. Now there's nowhere for your brain to go. So it herniates down, meaning it kind of pushes its way down towards the base of the skull into that hole, foramen magnum that we have. And that's where the brainstem comes through. Imagine pushing your brain, since it's soft, and squeezing it through this area causes sudden death. Now, obviously that doesn't happen to everybody, but it can worsen your concussion. Your symptoms are what they are before, when I mentioned before, with all these different things, the headaches, the straining of the eyes, the dizziness. Imagine you're getting better. Your brain is kind of resolving and improving. I feel better. It takes me longer to get dizzy. It takes me longer to get eye strain. It takes me longer to get a headache. I'm able to do more. And then I go back in because I'm thinking I'm better, and I can go back into the game, or another game 3 weeks later, and I go back in and I get another head injury. No, you don't always herniate your brain through a small hole. No, you don't always die, but it can definitely set you back where you were getting better, and now you feel like you have these symptoms again, or a different part of the brain was injured, and now you have the cognitive part in addition to the ocular and vestibular parts. So that's why it's different for everybody, because you don't always hit the same exact part of the brain. You know, you and I could both get a head injury, and I may have the ocular dysfunction part, meaning eye straining, eye motion bothers me, but I can think clearly. Your part might have the brain, the higher functioning part of the brain might have been injured this time, and you're having a hard time speaking normal or repeating yourself, or people like me right now to you don't make sense because you're like, I lost you 10 minutes ago. Like, I have no clue what you're saying. It doesn't make sense because your brain gave out, because that higher part of the brain was affected this time, but your eyes are fine. Or you can have the ocular, vestibular, and cognitive and get all three. And that's why we individualize it based on where your injury is, based on what you're feeling, because you don't always have to have the same injury. But the second impact syndrome doesn't always exist to everybody. It might be very, very mild to the point where you just worsen your current symptoms or added another one to it. So that's what the second impact syndrome could look like.
So now let's say an athlete has had an injury. It's pretty obvious they're sleeping all day long. They're having some visual issues, some dizziness. What is the first thing you do besides obviously a physical exam? Is there imaging that you go to right away, or do you just assess the person based on their physical examination and asking them questions?
So the major misconception is that people think you should get the CAT scan is always important in the beginning, only if we're worried about any of those red flag symptoms. That we're looking for a brain bleed basically at that point. But even when people get that first injury and 3 days later they're just not getting better, you kind of feel good that you had your brain bleed checked out and there is none. But as you can see, a concussion still exists. A concussion does not show up on any imaging study at all, because they are basically at the microscopic level, brain cells leak out, brain cells the neurons twist and turn, they shear off, they disconnect from each other, so that communication from one cell to the next cell is no longer there. We have glucose, sodium, potassium leaking out. So imagine the brain cells having to come together again and heal. But we disrupt that process by trying to do normal things that we take for granted, like moving your eyes too much and moving your head too much and thinking too much. So that's why we say brain rest.
Got it.
But you're not going to see that on imaging studies at all, unfortunately.
All right. So the question that always comes up is to sleep or not to sleep. Like, is sleep is the right thing, or is it too much is not a good thing? What is your thought, or is it dependent on the time after the injury and how recovery is happening?
The first 6 to 12 hours are the red flag zone areas where we're looking to see if somebody is going to do anything that's worrisome and take them to the hospital. But usually someone after a concussion, they're so tired, their brain is on its fried. It needs to just reset. And that means decreasing all the stimulation possible, similar to somebody with a migraine. People with migraines, people can visualize that one, right? You don't see it, just a concussion, you don't see it. But imagine having a migraine, you're dying to go sit it out, dark room, sleep it off. If I open my eyes, the whole room is spinning. I'm falling all over the place, headaches like crazy. I just want to sleep it off. Very similar to a concussion where I just want to sleep it off. I feel drained mentally. I feel so exhausted that I just want nothing more than to just crawl in a rug and be left alone. No thinking, no talking, no noise, no lights, just sleep. And maybe the first few hours you want to just make sure that they're okay. But for the most part, when they come home after an injury like that and they're wiped out, tired, they need to sleep it off. There's not much more you can do. Waking them up, shaking them up, keeping them up, just like people used to do. It's not a good idea anymore. Now we recommend that they sleep it off. And problem is, after 3 or 4 days of waiting for your brain to heal, are you still with me? Because I lost you.
I am. We can hear you perfectly fine, but your screen is frozen. So it's okay.
Yeah, I feel like I lost it. It's coming back again. It's connecting again. I can keep talking.
It's okay. Yeah, keep talking. This is what we want to hear more than anything.
So yeah, we're always concerned about letting them sleep. We do recommend letting people sleep it off. That's going to be the key, unfortunately, is to sleep. And usually the first 3 days, the first 72 hours, we recommend people to do nothing, meaning don't go to school, don't go to work if you don't have to, don't engage in any activities, but do start to try to do something mild, like walk around your house and try to get up at a normal time and see what happens and just test it out. But for the most part, 72 hours of doing nothing. If that means sleeping it off for 72 hours, you're letting the brain rest as much as possible. And that's what most of the time helps people. I'll get a call on a Friday that someone that I know, a neighbor or friend or somebody their kid got hurt and they don't know what to do. They're panicking. So I tell them to look out for these little things that we talked about, the headaches or this or that. You make sure they're not throwing up, all those red flag symptoms. And if they're not doing any of those things, to just let them sit around at home and just sleep it off, lay in the couch, lay in bed. And the hope is that the more of nothing they do, the faster the brain is going to heal. And after 72 hours, if they're not 100% and they still have some residual symptoms. Are you with me?
Yep, again.
Okay. It just changed the screen here. Maybe they're 90% better, and that's a significant improvement compared to the way they were. That means they're able to walk around more. Maybe they can go outside. Maybe they can actually get some schoolwork done. But the first 72 hours, we say just cut back on any cognitive things, thinking too long, having long, detailed conversation about your future, things that you just don't want to be engaged in at that time, or because you're not going to think clearly.
Sure.
So yes, letting them rest is ideal. Letting them rest and sleep it off will be the best thing they can do.
Okay. Anything, I remember when I was in medical school, actually, we were playing flag football and my head went up against this other guy's head, big melon. I got smacked. I ended up having a concussion for sure. It was probably about a 72-hour period of time that I was down and out. And I literally couldn't do anything. I mean, the nausea, I could barely keep food down. So I just needed to literally shut down. And at that point, it was just, I had to get back to school though. And that, there's all these pressures, that, you have when you're young, going to school and you get injured. I'm not an athlete by any means when I was in medical school, but to try and get back into the routine was so difficult. Are there anything proactive that you can do, or is it literally just, hey, listen, you just gotta, take a time out at this point and let things heal? Is there anything that you would recommend in that shorter period of time from a nutrition standpoint? Is there anything out there that talks about healing as far as nutrition or just even mental health, like what you should be thinking about at that time, or is it just rest?
If it's acute in the first few days, really, there's just more like letting the brain rest. Now, you want to be proactive, and a lot of people have talked about this, and this is actually good evidence of this. Omega-3 fatty acids, fish oil, those kind of things are good for the brain. So the faster you get that in your system, they're saying that it could have a protective effect of the brain by helping you heal quicker, cognitively think better. So instead of your usual dose of whatever they tell you on the bottle for like 3,000 milligrams of omega, 3s and such, they say to kind of double those things and maybe a couple of times a day. And the faster and the more you introduce it to your body, as soon as you notice the injury, the quicker the response of improvement. So we do recommend those things to people anyway. Some people have a history of migraines and they have a constant pressure headache when they are dealing with a concussion. Some people have headaches that just come and go, but the people that have a constant pressure headache that's there 24/7 because they have a history of migraines in the family or in themselves, we tend to give them magnesium and vitamin B2. Vitamin B2 is riboflavin, not B12. Magnesium and vitamin B2 are known to help, are cofactors that help brain cells heal quicker. So it can't hurt. And that's something that we recommend and we prescribe to patients too.
And then is that oral pill form or?
It is oral. So yeah, even if you didn't have migraine history, it doesn't hurt to at least try to take that because it may actually speed up the process too.
Okay. And then it's
staying
just
hydrated, things like that.
Hydration, yeah, that's key. So, a lot of most patients that have a concussion, a mild brain injury like this will just slowly take their time and recover. But it's fortunate for the patients that the patients have someone like you to be able to go to if they're not recovering from something like this. These unfortunate individuals, what do you do with them that are suffering for more of a subacute to more of a chronic, longer term issues? What do you see and what do you do for the patients?
We've had people, my experience is that when we can't get to these people early on, some people have recommended people to us, some people have referred family members to us because they've had a good experience and a good outcome. So they would send us someone that maybe they know that have said they've been like this for 10 years. For example, I have a case of a patient who, she's a teacher and teachers are their own breeds too. So it depends what kind of work you do because that takes a toll and does influence how you get better or not. Nurses, teachers, physicians, these are all type A type of people and they don't know how to shut down. So you have your natural anxiety. So we have to take all that into consideration. But the people that have taken 10 years out, for example, a teacher who fell in California taking pictures, she's from Pittsburgh, she fell off a cliff. Believe it or not, she fell off a cliff and she became a Jane Doe. They found her, they, figured out who she was eventually, and she came back to Pittsburgh and just been cognitively declining for like 10 years and trying to function. But again, she thought this was her new norm. Found us at some point, and that led to us teaching her how to avoid or teaching her at the right timing when to pause. An example of that is if I talk to you for a long time like this, the way I'm speaking, my brain could only handle so much for a certain time before I notice my first warning sign. My first warning sign is when I start to break down, I start to repeat myself or I get stuck on a word. My brain just gave out. And I keep trying to push through that stuck moment. And instead of just saying, give me a second, Jay, let me get my bearings straight. Letting my brain reset for about a few seconds or so. And then my brain resets, I feel better, and I know what I was going to say next, and I jump right back in again. But we don't. We push through that because we get frustrated, we get anxious. I used to be faster than this. Why do I feel slowed down? I don't get it. I'm a teacher. I know. I got all these 20 kids. I know their names, and I'm forgetting everybody's name. I don't get it. I get so pissed off. And they get frustrated.
Sure.
That they end up pushing through that first stop sign that I call it, balloon filling up, and now they're getting their pressure headaches. Now, if they stop at that point and just say, Jay, give me a minute, I need to really sit down for a minute here, it's going to take me 20 or 30 minutes to regroup or reset my brain. And then I'll be able to resume where I left off. But no one has 20, 30 minutes of downtime. So if I can teach them to stop as soon as they notice that they're breaking down, like I'm forgetting what I'm going to say, and that's what they sound like. They sound like they're stuttering, and they start to come to you saying, I stutter all the time. That's not me. I used to be able to do this. I used to be able to do that. You can see the anxiety that I get just talking about this, because this is what reflects them. And they say, that's exactly what I do. Okay, well, stop doing that. Well, what do you mean? Stop at the moment when you feel like you're breaking down and you're becoming anxious and frustrated because you're not as fast as you were before. But if they just stop right there every time, if they just stop right there every single time they get stuck, having a dinner conversation. Oh, I used to be able to do, what was I going to say next? Oh my God, it was on the tip of my tongue. Well, there's a lot of that. And they want to push through and remember, like, oh my God, hold on a second. Let me think about this. I know what I was going to say, but just stop thinking about it. If they just stop thinking about it, all the symptoms go away. They feel better. And then it comes out natural, like, oh, I know what I was going to say. But they don't. They fight through that feeling, and then they push harder, and now they got a headache. And if they push through that too, boom. I call it a blow up, where the brain kind of just goes haywire. Oh, I feel like I just got a migraine. Now I just want to go to bed. I'm tired. I'm suddenly exhausted, but I was just fine a few minutes before that. So I basically just gave you 2 stop signs before you blew up, so that way you can avoid the blow up altogether. When you go haywire, you end up lights bothering you, noises bothering you. Definitely can't remember what you were going to say. I'm all of a sudden tired. I just want to sleep it off. I'm done. And now it takes 6 to 12 hours to reset your brain. That's why people can't sleep. And that's why they wake up in the morning while they're recovering, still feeling miserable. And that's why the next day they feel like they're a little bit better, right to themselves again. And then they're like, oh, it went away. Then they go back to trying to do the same thing. Boom. I was just paying my bills. I wasn't doing anything. Try to do more than 2 or 3 bills and try to calculate and everything. Instant blow up. They're wiped out.
Wow. I see a lot of similarities with another brain injury that we would see in the rehab hospital quite a bit, which is post-stroke. Individuals that have had strokes have a lot of the same similarities with their recovery, some of them with frustration with the language. And it's one of those things you have to teach them kind of cues to learn about themselves, but then also techniques on how to work around those types of scenarios and those problems. But you're trying to get those synapses and the nerves to start working properly again, but just at the right pace instead of pushing it too quickly. And understanding that
Right.
that frustration level is working against you rather than for you.
You're right. And it's frustrating because now you have to think about the anxiety and the depression that comes with this, the psychological aspect, which takes a toll on people. And if we don't address that too, we're not being comprehensive enough.
There was
it does take a toll on them.
right. There was also when we had patients that had more of a severe brain injury, there were also steps that I remember that the healing process would go through, one of which was agitation. And besides, obviously, the sleep issues that you had just talked about, do you run across personality changes at all, too?
A lot, I do. And I do notice that if we can control a lot of these things so they don't fly off the handle, that is one of the consequences of having either multiple concussions. We don't really know that far out because it's hard to tell what's going to happen with these people. And if they already have an underlying issue, then it's definitely going to be confounding and on top of the whole thing. It's going to be overwhelming, and it can lead to personality issues, but there's usually something underlying all this stuff already. You know, you have people with ADHD, you have people already with anxiety, depression, multiple psychiatric issues in general, bipolar disorder, and then you got a concussion on top of that. I feel like it amplifies what you already had, and it just worsened. So having a personality change, I look at that more as a mood issue. Their moods are just altered. They're just wiped out. They're zombie-like. Their mom is like, he's not like this. This is not who he is. He's different. Because they're living in that blow-up state of mind where they're just migrainous, almost like they're just out. But if we can teach them to avoid those things because of two things that come just before that we found that are predictable, then you don't ever have to feel like that again. So we can try to capture people and see if we can get them as close enough to 100% as possible, but I can't ever guarantee that. But I can tell you that we've helped people 10, 15 years out get closer to 100%. And there's got to be a reason why you feel the way you do. Like, we keep looking for that. There's always a reason why you still feel the way you do. And when we uncover what that is, they don't like it because they've been able to manage and cope for years. They've been able to get through it for years, but a whole different person. They've been able to manage this for years. And then when we uncover everything that they could have been holding down, almost like a behavioral therapy session. And when you bring it out, it's a big mess. You find out that they are depressed. You find out that they're anxious. They just didn't want to admit it. They're having resentment. They feel guilty because they're not the same provider that they used to be for the family. And you can imagine it's such a process. But if you get them to the right therapist after that, maybe it takes 6 months later, but they come back to you saying, I can't thank you enough for. I'm like, I'm sorry that I caused such a strain in your relationship, your marriage, your family. No. At first it was like that, but now that I know more about myself and why I feel the way I do, we have such a closer relationship. We have a closer marriage, a family. I'm there for my family more than I was before because now I'm emotionally there. So it uncovers other stuff that they just never dealt with because they've been holding it down and leading to those personality changes. So it has done a lot of wonders and a lot of good by addressing everything, not just saying, do you have any headaches? Nah, I'm good. It's not that bad. Well, you shouldn't have them to begin with. But for them, it's just not that bad that they're okay to move forward with it and stay like that. So to each their own. And sometimes we can tell people you shouldn't be having that. It's coming from something you're doing. And they're like, nah, I'm good. I'm fine. You know, it's okay. The headache is not so bad. I can still do stuff. Yeah, but then they get that tired feeling. Like, yeah, I get tired once in a while, but it's not a big deal. Everything is not a big deal. It's always watered down. It's always it's not that bad. And that's the problem. People keep walking around like it's not that bad. It's not that it's that bad. I'm not worried about the eye strain when you get it. I'm not worried about that headache that you get. I'm worried about that blow up that comes every day that makes you feel like you're just wiped out and tired. But they tend to work around that and say, honey, you know, she knows when I've blown up. I just go to my bed and sleep it off for a few hours, you know, and I'm good the next day. That's lingering. That's what's making you linger. That's what makes you not right still. If you get rid of the blow-ups, your brain rests more and you actually heal up more. And that's what we've been focusing on, those flare-ups, those blow-ups. So we kind of work backwards. We realize people feel like zombies, wiped out, exhausted. They can't focus. They can't concentrate. They're tired all the time. And realize that all those symptoms happen in one sitting because they're fine before that. So we're trying to figure out if there's a before and there's an after, there's got to be a transition point where they know it's coming. So by asking all these patients, I see about 220 concussions a month, asking them over and over again, what comes just before your blow up? Headaches. Okay. What comes before your headache? It depends what is your main dysfunction. Is it ocular? Then you get eye strain before your headache. Is it vestibular? Then I get dizziness before my headache. And if it's cognitive, I start to break down and start to get confused, or I start to repeat myself, or I don't understand something, or I get stuck. If they just all stopped at that first warning sign, they don't ever get their headaches, and they're miles away from blowing up. To me, blowing up is like falling off a cliff. Once you blow up, you're done. But if I can put 2 stop signs in front of that cliff for you, you never have to go over and feel miserable. So you feel like you're healing from a concussion without feeling like you have a concussion. And you get to the day successfully, and you can focus, and you can do everything you want to do as long as I can teach you when to stop at the right time. not just stop and take it easy and tell you, relax, it's okay, just take it easy. Okay, I was at home, but you're blowing up at home every day. But I wasn't doing anything. Your definition of nothing is watching a movie, being on your phone at the same time, and being on the computer at the same time. I'm blown up instantly. And I didn't realize which one did it because I was doing too many things. Or I was doing laundry and my head was going side to side. And I was like, I was fine. I wasn't doing anything. You were doing laundry. Yeah, but I always do laundry. Yes, but after your injury, it's different. Doing laundry requires a lot of head motion. But if I can teach you to keep your head still while you do the laundry, you never get dizzy. If you want to exercise and run while you have a concussion, I can because I get dizzy when I run. Then stop looking at the floor when you run, because if I'm looking down and I'm just seeing floor motion, treadmill, street, I get dizzy and I get a headache and I blow up. I'm wiped out. I'm exhausted. So every time I go running, I'm wiped out. But if I look straight at the horizon at something that's not moving or at the wall, I can run as long as I want because I'm not activating the vestibular function. So teaching people, knowing what's wrong with you and doing it differently, you can do everything you want to do. And without activating any of those pathways, which allows you to get better quicker and you still function normally. So a lot of it is education, but we found a way to, it's the delivery and adapting to everybody you're dealing with because everybody's different, from nurses, teachers, doctors, to blue collar workers and work truckers, people who just want to just do and not care about themselves. But then they're not functional. And then they really feel like they're not functional because they feel guilty because they're not providing. So the heart of it is, if you're not providing for your family, then let me teach you how to do your truck driving without being miserable so that you don't have to be home all the time.
Sure. And I can see how, like, if a patient doesn't have a physician that's giving this great care, they can have relationship issues. They can have issues with their employment. I mean, they could have, criminal issues because they just get so frustrated. They have nowhere to go. So the only problem that I see is that, I know very little about this, but I know that what I hear from you is that it takes time. It takes somebody that really will dive into this and see patients on a regular basis to see, each step of the recovery where they're at. Who do people go to? Not everybody can come to Pittsburgh to see you.
No, I've called people. People have called me from New York because they've gone to New York Langone Center for concussions. I feel bad because I know people, I'm obviously open to different ideas and suggestions, but, I'm going based on what I observed. And we're doing our own study to prove that every time you feel something is directly related to something you just did. So that means you can turn it on and off like a switch. But when people go to these centers and like a mill where they just go, and you have 10 minutes with them, 5 minutes with them, it breaks my heart because I feel like nobody's really talking to patients like this. And occasionally you find a small person, a pocket of areas that people are spending a little bit more time with people to educate them, but people are going to get better anyway. For the most part, they don't need all this conversation because I don't see all those people, but the once in a while that you get that extra person that doesn't get better, I definitely want to challenge and I want to definitely help these people. And if 10 years ago, someone had these issues and they're still having it now, and what we applied now starts to help them within a few months, that says something. That makes me feel like what we're doing is right, even if they've seen 3 or 4 doctors prior to that. So I have people who have seen and swear by their doctors that they've seen for years. And they say, well, this is the best you're going to be. And they accept that because they have closure. Someone said, this is the best you're going to be. So they're like, okay. And my brain just turned on and said, accept that. I'm going to move on with my life. And they're fine living like that. They don't need someone like me to aggravate them again, to bring it back out again. It's almost like, pulling a scab off. For people outside, if they can take some of the knowledge or some of the education that I'm giving them, would be to, when you feel something, it shouldn't be there. It wasn't there before the accident. And all of a sudden it is. You need to stop that activity that you just did. Look back. What did I just do? Put 2 and 2 together and realize, okay, so every time I do that, there's an association with me feeling this way. Maybe I can do it differently, or maybe I just won't do that for a little while. And some people will either have the time and patience to look at that and figure it out, because I've had patients come and tell me, oh, I've been doing that already. I'm like, well, perfect. You figured it out yourself. You find your own pattern. But just to let people know out there, and maybe hopefully this podcast can reach out people, everybody has their own pattern, whatever job you do. But if you just pause for a few minutes or less, that feeling will go away. And then you can reset your brain and go back to it again. You don't have to push through anything. And the misconception is that we push through things in life to get us to where we need to get. Yes, we are strong individuals. We have strong-minded people out there. Push, push, push. You know, if you don't push hard enough, you're never going to get somewhere. That's true with a lot of things, but it's not true with a concussion. I've noticed it backfire.
Yeah.
Because I've had people for years push through, even though they don't think they're doing a lot. They're pushing through. They're just not feeling great. But, you know, what am I supposed to do? Stay home and not go to work? Well, we can't be extremists either. People sometimes take it too far. That's not what I mean. I mean, pause at that very moment. If you're looking at your classroom and you're full of kids and your eyes are going all over the place and your eyes are straining, you don't keep doing it. Just focus on one kid at that moment. And that makes your brain rest. I'm not asking you to leave the classroom and take a break. I'm asking you to stop looking around. Or if you're watching a hockey game and your eyes are moving side to side all over the place and my eyes are bothering me, I don't have to leave and take a break. I just stop moving my eyes and look at one part of the TV for a few seconds. I feel better. I can go back to watching the game again. That's the kind of break I'm talking about. If I'm getting dizzy moving side to side, then stop looking at all the kids in the classroom or looking at the board and the kids, looking at the board and the kids. Just look at the board for a little bit while you're talking and then come back slowly and look at the kids for a little bit. Or if you're talking to 3 or 4 people, look at one person at a time. Those are the kind of breaks I'm talking about, because you don't have to leave your environment. You don't have to give up what you're doing. There's so many tidbits of information I want people to know out there. It's just, it's you don't have to be miserable anymore. And if you are having a hard time, reach out to a sports medicine doctor or concussion specialist, because a lot of them do know some of this stuff, and they do know that, you know, that it's best to take breaks, but sometimes it's best to know when to exactly take the break. Neurologists, it's the other misconception. There's neurologists out there that do like to deal with concussions, but a lot of them look at it as just a tincture of time. It's always a tincture of time. And if you just wait it out, yes, you'll eventually feel better. You'll get closer to feeling better and better and better. But some people take years to do that. We're just being proactive and giving you more information that you don't have to wait years. You can do it quicker. You can do it right now. But a lot of neurologists like to go, not deal with this stuff, and they'll pump you with medications for this. And the way we do it, we don't even need medication anymore, because if you just recognize the stop sign, you don't need to take a medication for your headache. You just stop what you did, and that makes the headache go away too. So again, you know, try a sports medicine doctor if you're stuck out there and you're seeing neurology. A neurologist is telling you to take time. You know, you can do something in the meantime. There's educational things, there's websites, there's different things out there, but I suggest that you don't push through things, you push up to it and not through it. And you will notice significant improvement just stopping at the right time. But it doesn't mean that you can't do anything. It just means try not to put yourself in a position where you can hit yourself again. Don't put yourself in a contact-related position where you can aggravate that and have a major setback. So do everything but contact-related sports until you're 100%.
Great advice. So let's, I always want to try and get a little bit behind the person that's giving the message here, just so that people understand a little bit about you. You know, we hear what you do professionally, but what do you do, you know, on a day-to-day basis yourself with exercise, nutrition, mental health? We always like to know a little bit about the physician or the person that I'm interviewing. So what do you suggest for a successful life, besides obviously your family?
Well, obviously the family is there. That's part of the support system. If things are not right there, you can't really focus as well as you can on yourself. So that's primary for me. But secondary is, I feel significantly better after working out. I've been trying to be very diligent and disciplined about getting up earlier. That has made a big difference in my life. If I get up, and I know it sounds weird, but I've been trying to focus on a time point in my life and in my days, like 4:30 in the morning, 4:45, maybe 5 o'clock in the morning to wake up and come downstairs and work out in my gym. Even if I had access to the gym, I would go. But in this case, I noticed working out has helped me think clearer, has set the tone for the rest of my day. I feel that's the perfect quiet time in my house where no guilt, I don't have to tend to anybody. I don't feel guilty because I'm not playing with my family or kids. I just feel like it's my own time and nobody to bother, or nobody bothers me. I don't bother anybody, but I can spend an hour there and do some weight training, do some jump roping, doing some boxing drills and skills, practicing my stick fighting stuff on a bag. Just literally just clearing your mind, and then it sets the tone for the rest of the day. I feel great, and I feel like a better man, a better person. I've been taking lessons through the athletic commissioner. He's been teaching me boxing skills, and it's a skill. You're exercising, but you're learning a skill at the same time. So I'm looking at it that way. Instead of just exercising, I can get a skill while I'm exercising. It's like learning another language, and might as well take advantage, especially with these tough times right now with the whole coronavirus thing. Getting away from it all and exercising and just, like everybody's saying nowadays, we're actually enjoying our time closer with our family, enjoying the simple things in life. I feel better. I feel so much better knowing that I can do all this for my family and that I can actually take care of myself. I feel more invincible, I guess, because I've been trying to discipline myself more, doing combat training, putting your body through things that you didn't realize you can do. And I just turned 45 just a few days ago, and it's just, I'm happy to feel good. Just the other day I was playing outside with my kids, and we have the baby, a 1-year-old. So of course I like to throw him up in the air, but then I have my 8-year-old son who will throw me. And I was like, there's no way. And then I was able to squat down, lift him up, and I threw him up about 4 feet in the air and caught him. I'm like, you got to be kidding me. I just never felt that strong. So it's working. Whatever I'm doing, it's working. And I'm able to, my daughter who's 10, she wanted me to throw her up in the air too. It's just, didn't get hurt. And I'm not saying for people to do that, but it makes me feel good inside, normally by now your back is hurting.
Yeah. I talk all the time about how the mind and the body are so interconnected. And I think you bring up a great point there. When you're actually taking on a new sport or, martial arts, or I don't even know what stick fighting against the bag is, but that sounds pretty cool. I have to do that when I come out and visit you. But the idea is that your mind is now trying to be challenged during an athletic event to try and work differently, and it really kind of gets the things going a little bit differently than you're typically used to if you still do the same exercise routine on a day-to-day basis. So learning new things, we always think of it like new challenges from a mental standpoint with crossword puzzles or reading books or things like that, but challenging yourself with new exercise routine is a different way that I think is to bring that exercise mind-body connection, which is awesome.
I think it's great. I think I sometimes, I used to be a personal trainer a long time ago, and some of the things that you get tired of doing the same bread and butter type of exercises. So I turned to, back several years ago, we did the P90X thing and a bunch of other stuff. But nowadays there's things like Athlean X, which is like a guy who does a lot of this strength training in different ways, different capacities, from band work to pull-ups to push-ups to weight training. So it's a little bit of everything. In addition to that, I do the boxing and everything. So I feel like it's another piece to you, it's being well-rounded, healthy. The healthier you are, the better mentally you're going to be, the more you can give other people. I try not to, I'd never want to define myself by my job, but it's another attribute to you. So everything I do, it's humbling. I'm humbled by the responses that we're getting from patients, and it makes me a better person, a better doctor. It's humanizing medicine for me. Understanding that if I'm talking to a patient, I want to make sure their spouse is there too, so that they're on the same page, because I'm predicting that it's causing them domestic issues at home. And when you bring it out, everybody's in tears crying because they're like, that's exactly how we've been for a year or two, because they're not connected. And, you bring it out to the surface and then you deal with it, and then they're appreciative. I try to apply that in my own home, and sometimes you get lost, but you got to bring your stuff back. And there are days that you don't want to do anything, and sometimes that's fine too. Mental health day, right? So,
yep. Well,
it's give and take.
You're a great father, family member. You are an unbelievable physician for your patients. I want to make sure that if someone is in need and wants to get in touch with you, how do they do that? You want to,
I appreciate that. Thank you.
Yeah.
Yeah. So again, my name is Mark Alcala. I work for the Allegheny Health Network Orthopedic Association Associates, and located in 4 different locations, but I'm primarily in the Pittsburgh North region, Wexford. And in the Wexford area, we have the Wexford Health and Wellness Wexford Pavilion. And in Cranberry, we have an office there as well. We also have an office at the Pediatric Orthopedic Institute, which is also in Wexford, across the street from the Health and Wellness Pavilion. And once a week, I'm in the South Hills at the Cool Springs facility to kind of cater to people in the South area of Pittsburgh. But our direct number to call our coordinator, Denise, her number is 724-933-6629. And if anyone ever just needs, questions answered or what they can do remotely by phone or whatever, I'd be happy to do that too, because I hate people feeling like this, and all they need is just a little bit of education, maybe 10 minutes of a conversation can go a long way. So I appreciate it, Jay.
That's awesome. Well, thank you so much for your time. And I look forward to, obviously this coronavirus passing so that I can come out and see you. And, I can't thank you enough for taking the time this morning to talk to me, and for everybody else, we all thank you too. Have a great week. And we'll connect soon. Okay, my friend.
Dr. J, thank you so much, and good luck with everything, and be safe out there.
Thanks, brother. Thanks, everybody. Thanks, Marco, for helping us reach a place called success. Dr. J, you guys all have a good one. Thank you.
A loop called confusion, speed bumps called friends, and red lights called enemies. Caution signs called family, and flat tires called jobs. But if you have a spear called determination, and an engine called perseverance, with insurance called faith, and the drive to make it, you'll reach a place called success.